Hi, I'm Dr. Ben, and today we're going to talk a little bit about fillings and why they're important for your mouth. A filling is needed when there is broken or decayed tooth structure, which is then replaced by a filling. It's important that if there is any broken or decayed tooth structure, even in the absence of pain, that the tooth is repaired as soon as possible, otherwise it is more likely that pain will arise in the future. This is why we advocate for routine, 6-monthly checkups to ensure that if anything is developing in your teeth, we can quickly address the problem and hopefully avoid any pain in the future. Typically, there are two types of fillings, the old metal fillings called amalgam and the white resin fillings. We use the white resin fillings, which not only look a lot nicer in your teeth, but also the big advantage is that it allows us to be conservative, which means retaining as much healthy tooth structure as possible. Often for filling procedures, we will place anaesthetic in the mouth to ensure that your tooth or teeth are numb. For patients that are super brave, you may choose to have a filling done without anaesthetic. However, usually this is only possible for the shallower fillings. After this, any broken down or decayed part of the tooth will be removed until there is only healthy tooth left. The tooth will then be treated so that we are able to bond in our filling at a microscopic level. This differs from in the past with old metal fillings, where you would have to remove more of the tooth so that the filling would lock into place. Once the tooth has been treated, the filling will be placed in the tooth. The last step involved will be to ensure that any excess is removed with some polishing and to ensure that it is smooth and comfortable in your bite. Fillings can vary a lot in how long they will last. For the majority of fillings, they will last somewhere between 7 to 10 years, but there are many factors involved, including things like how well you look after your teeth, how big the filling is, and how much biting pressure you put on the filling. Because the timing of how long things last varies, 6-monthly dental checkups become important in order to determine the correct timing to address any issues that may arise in your mouth. When we've lost a large amount of natural tooth structure, the best option becomes replacing the resin material with porcelain, which is much stronger and can protect the teeth from further chipping or cracking. The way we do this is through preparing the tooth and placing a protective cover over the tooth, which is what we call a crown. Often, we may decide for a similar covering called an onlay, which serves the same purpose as a crown but conserves more tooth structure.
This adhesive is then cured with blue light so that it is hardened. The blue light waves have energy required to polymerize the bonding agent. The white filling material is then placed into the cavity preparation shaped with special instruments and cured to hardness by the blue light. Final anatomical details and shaping of the filling are accomplished with a high-speed drill and special drill bits. White fillings are not only highly aesthetic, but their bond strength and compatibility with existing tooth structure make them a good choice as a restorative material.